any other medical condition, the diagnosis of AS is made by taking a good history, physical examination, blood tests, and imaging. So during a medical interview, the doctors will ask you for symptoms, function, quality of life, whether there's any other medical conditions, medication history, family history, and social history as well. The physical examination is usually a general exam, but we do focus on certain things, especially on the spinal mobility, because AS affects the spine. We will still examine the other joints, the eyes as well, and of course, the heart and lungs as well, due to the possibility of involvement of other things. In terms of blood tests, we start with routine basic blood tests. We will also be checking inflammation markers, HLA-B27, and some tests for infection in case you require medications. And so on diagnostic imaging, we have normal x-rays of the pelvis to look for what we call sacroiliitis. We also look at the spine for what we call bridging syndesmophytes. That's when new bones start to form and start to fuse. And, in advanced cases, we have what we call a bamboo spine, because everything fuses together like this. And so nowadays, though, there is a certain degree of urgency in treating AS to prevent any fusion. And so for that reason, we have moved towards performing MRIs in patients who are symptomatic, because we need to look for evidence of acute inflammation or even evidence for previous inflammation which has settled down. And the areas of interest are usually that of the spine as well as the sacroiliac joint, which is in the pelvis near the buttock region.